Cervical cancer is a cancer that arises in the lower part of the uterus called the cervix. Moms that have babies, when they dilate, the part of the uterus that dilates is called the cervix. The way I describe this is Northern California is the uterus, the top part of the state. The southern part of the state, which is connected, is the cervix, Southern California. And so while they have different names and very different looks, they are very related because of their locations and connected to each other. For you, when you see your OB/GYN, she or he does an exam. What they're feeling is the cervix and potentially the uterus, and when they do a pap smear, they're checking the cervix for cancer. The cancer itself is staged in various stages, 1, 2, 3, and 4. There are different ways to treat this cancer based on the stage. An early stage cancer is often treated surgically, and we remove the cancer, and there is usually an opportunity to keep the uterus and the residual cervix to have babies. Unfortunately, if there's a late stage cancer, we'll have two options. One option is a bigger surgery that may involve removing the cancer, which would include the uterus and the cervix. The second option would be something called chemotherapy and radiation, where we use both of those treatment modalities to make sure the cancer goes away. The most important distinction here is what stage you are at the time of diagnosis. I would encourage you to seek out a gynecologic oncologist such as myself, someone who specializes in this type of cancer when you're initially deciding how best to treat this. Because again, the options are dependent on the stage of the cancer, and that usually requires a specialist to help assign the stage. When you go to your OB/GYN for an annual checkup, what are things that you should discuss with him or her to reduce your risk of developing cancer? Mention any concerning symptoms. If you're having bleeding between periods, bleeding with sex, new pelvic pain, something that is different for you, something feels different, it's okay to mention that. I would encourage you to do so. We want to know that because that gives us the information that we need as your doctor to help make the best clinical decisions to keep you safe. Another thing to discuss is the HPV vaccine. This cancer, cervical cancer, is predominantly caused by human papillomavirus, HPV. It's a very common infection. 80% of the population has been exposed to it. We now have a vaccine that prevents that infection from taking hold and impacting you in the long run. I would encourage you to review with your OB/GYN or your family doctor. Are you a candidate for the HPV vaccine? And if so, can you receive it? Also, talk to your OB/GYN about how frequently you should be getting pap smears. These recommendations do change fairly frequently, and it's really based on your age, your prior history of pap smears, and whether you tested positive for HPV in the past. That information is then collected, and your OB/GYN can give you the information necessary to tell you you will need a pap smear next year, or you will need a pap smear in 2 years, or you'll need a pap smear in 3 years. The other misconception is that when you go to an OB/GYN and they do a GYN exam, which is when they, again, look at the cervix and feel the cervix by hand, don't assume that they're doing a pap smear. You should ask them, are you doing a pap smear? Or when will you do a pap smear next? And they'll talk to you about when that will take place. And I would encourage you to advocate for yourself again and have those questions answered. Things to think about if you're a patient who has HIV, if you're someone who has a transplant, a liver transplant, a heart transplant, a lung transplant, or if you're someone who has an autoimmune disease where you take medications to suppress your immune system, you're likely going to be at high risk for an HPV infection. And so for you, the frequency of pap smears is going to be different than someone who has an intact immune system where they have the ability to fight off the HPV infection more effectively. Also, it's very appropriate to ask your doctor after the exam, did you feel any abnormalities? Did you see any abnormalities? They'll describe to you what they see, and that's important that you have an understanding of what they're seeing so you can describe this to your other doctors or know what to look out for in the future. And then lastly, don't assume that if you have not heard from your doctor that your pap smear was normal. I see many patients, and it's not uncommon for them to say, oh, I didn't hear from Dr. So-and-so, so I assume my pap smear was negative. While that may be the case, you should get the result, whether it's a phone call from the nurse or a secretary, or if you get a letter in the mail, get that information. You took the time to go see the doctor, and you should collect that information as part of your health record to better understand what's happening with your body.